I am Dr. Tom, the CEO and one of the founders at Heidi. I work in product and go-to-market, so I'm talking to doctors and our users all day, every day. A lot of the things we build come from the experiences I had working as a doctor, seeing patients, kind of understanding how hospitals, clinics work. It helps us build the right thing, like the thing that people want to use, but also helps us understand how sensitive and challenging these environments are, and like maybe the implications of some of the features that we're likely to build. Yeah, I think it's a big advantage to have been a doctor, but I spend all my time at Heidi these days.
So we hear all the time that Heidi's clinician-led, but how has Heidi incorporated the clinician feedback that we've received to make sure it's appropriate to separate specialties?
So from the earliest days of starting the product, we had people from different specialties both in the team physically. So we have a medical knowledge team where we have doctors and clinicians that come from different backgrounds, like from physio, surgery, more general medical backgrounds. And they look at how Heidi performs for those specific specialties. So that's more the internal facing. And then externally, we track where users are coming from, both from regions and specialties, and they give us lots of feedback about how Heidi's performing, areas where we could do better on vocabulary or medicine names or templates or something else, and do lots of work behind the scenes to create templates, create the right settings, fine-tune models to perform for their specific specialty.
Yeah, interesting. Would you think that the amount of clinicians Heidi has in the team is a strength when it comes to kind of delivering a product that the clinicians actually like and want to use?
Yeah, for sure. It's a pretty intentional strategy. Like when we hire for roles that are going to be customer facing, where you're going to be dealing with clinical environments, it's just a massive leg up to have been there and seen patients. You'll understand how to set up Heidi in a way that will be best for the user, but also it means that they're just intuitively going to understand, what it's like to see patients that are really challenging, or in multi-user scenarios, like maybe a patient and a child and another family member all talking at once, or maybe people with different languages and maybe who are English second language, and thinking about how to handle that safely with a translator in the room. So all these complexities, having clinicians and like lots of clinicians in the team, I think we would have more than maybe like 1 in 4 Heidis is a clinician or was a clinician. And I think it helps us obviously build things safely, but also just deliver a better experience.
So you mentioned that 1 in 4 staff members at Heidi come from a clinician background. Now, I'm not one of them.
Yeah.
So can you tell me a little bit more about them? What role do they play in Heidi? Kind of how do they help in building Heidi into what it is today?
Yeah, so we have people in varying roles actually. So people in product, which is like more working with the engineers and focusing on the software part of Heidi. For example, Mo in our team, who's a doctor by background, but actually works full-time in product now. To more medical knowledge, where we actually work with, say, GPs and ask them for what are the kinds of documents that you create regularly, or with pediatric hospital we're working with at the moment, talk to them about the kinds of things they need to create. And then everyone from physios to nurses and doctors will take those requirements, have worked with Heidi, they're product experts, and will create templates and settings to recreate those documents really effectively. And then other places, support, customer success, everything in between.
Nice. So you don't have to be a clinician to work at Heidi.
Definitely not. No.
But it definitely helps in what we're trying to build. Yeah,
I think if you're working in product, so like trying to figure out what to build, talking to customers, so support, success, and then in medical knowledge, so like obviously understanding medicine, those are the areas where it's really helpful. So, it's not a hard requirement, but we definitely give people a extra point on the resume if they're a clinician.
Yeah, absolutely. So that means that because we have so many clinicians within the team and the continuous feedback we get from our users as well, that feedback loop obviously keeps going, and we continue to iterate on Heidi and keep building features and elements of Heidi that the clinicians actually are asking for.
Yeah, exactly. Like, I think it's kind of insufficient to just rely on user feedback to improve the product. So we have, hundreds of test cases that we regularly run Heidi through, where we find there are gaps in that kind of QA process that our users identify. We add to those test cases. And so as the product evolves, we add new features, we do different things. Yeah, there's both internally a continuous process, but we incorporate what we get from our users as well. And then in the wild, there's also like continuous monitoring of the quality of notes and other things through feedback ratings and some other mechanisms as well.